Hello students, welcome to Distinction Learning Platform. And on this platform, you find illustrations, you find explanation to difficult topics, you find a lot of stuff, revisions on how you can prepare yourself for upcoming exam. Before we begin our lessons, make sure that you subscribe so that you can be updated to all upcoming videos. Okay, to make the story short, let us begin. So this is the preclinical session. Remember that we are still talking about cell adaptation and we're under hyperplasia. Remember that this all information is Robin based. Okay. So what is cell adaptation? Remember that cell adaptation is a reversible chain of cells that is due to what? The change in the environment. Okay. If the environment surrounding the cell changes, also a cell has to adapt by undergoing cell adaptation so that it can maintain its intracellular homeostasis. Okay, so now let us talk about hyperplasia. What is hyperplasia? Hyperplasia basically is an increase in the number of cells in a given tissue. So if a cell increases in the number, then it's going to increase the organ size. Okay, so what is hyperplasia? Hyperplasia is the increment in the number of cells resulting in the increase in the size of an organ. Okay, now the question, so what are we saying? So hyperplasia is just the increase in the number of cells resulting in the increase in the size of an organ. Now, why do you think a cell can undergo hyperplasia? Why do you think cells can divide? Why do you think it should be like that? It is because a cell is experiencing increase in workload and also increase in functional demand. What do you understand by increase in workload? Remember that increase in workload, it is the amount of activity or the amount of work that is given to the cell. Okay, so that is what we call the increase in the workload. What about functional demand? Functional demand is the amount of work or activity that is required for a cell to perform. So that is what we call functional demand. Under hyperplasia, you will find out to say the cell is experiencing increase in workload. The cell is experiencing increase in what? Functional demand. The question is, what can cause increase in workload and what can cause increase in functional demand? So remember that there are two major causes of hyperplasia. There is physiological causes, meaning that normal causes, not because there is an underlying illness or condition. Pathological causes is because someone is having a disease. So those would categorize under pathological causes. So under physiological causes, remember that under physiological causes, we'll talk about two causes. Okay, so hyperplasia due to hormonal stimulation. So hyperplasia due to what? Hormones, not excessive, but hormones. So like if you look at females, the development of the hyperplasia of the glandular epithelia of the breast, of the female breast, due to what? When a female reaches puberty, when female during pregnancy and also during lactation, you find out to say there will be hyperplasia of the breast, meaning that the number of cells inside the breast is going to increase. Okay, that's a first physiological cause, because that's a normal thing that happens in females. Okay, that's under what? Hormones. Remember that there is what? Hyperplasia of female breast. Female breasts. So hyperplasia of female breasts due to what? When a female reaches puberty, when a female that's during lactation and also during pregnancy, there will be hyperplasia of the breast. What else? There is another one that can cause what? Hyperplasia. Remember that there is also estrogenic, like the uterus will become large in size. Basically, the number of cells inside the uterus will what? will become many. Reason being because there is the estrogen stimulation. So also hyperplasia due to estrogenic stimulation in the uterus will become what? Large due to the number of cells there that are becoming high. Why? Because there is estrogen stimulation there. That also happens maybe at puberty, maybe during pregnancy, etc. There are a lot of things, physiological causes of that. Okay, what else? So there are also, apart from hormones, there is also another important one, which we call compensatory hyperplasia. The first one that we are talking about was hormonal hyperplasia. Hyperplasia due to what? Stimulation of hormones. But the second one is what? Compensatory hyperplasia. Compensatory hyperplasia. So why do you think there is compensatory hyperplasia? So to compensate is to what? Basically, there was something, maybe a tissue was injured. If the body tries to correct that, mean that it is compensating. If you have a certain situation maybe in the body and the body tries to correct that, it means that the body is trying to compensate. So now under here, what is that compensatory hyperplasia? And why do you think it is under physiological response? Because there is a situation that they observe. If someone undergoes partial hepatectomy, mean that you are just removing part of the liver, and maybe for the various reasons, maybe liver transplant, you are giving that part of the liver to someone. Okay, the moment you remove that small piece of the liver, then what will happen? The liver will start what? Like the hepatocytes that were not injured will start dividing so that at least they can cover where there was an injury or the removal of a certain tissue. Okay, that is what we call compensatory hyperplasia. Because of what? Following the what? Partial hepatectomy. Okay, partial hepatectomy basically means that you just remove part of the liver. So that's under physiological. It's not a disease. If you remove something, it's not a disease. It's just it will be the normal response by the liver. Okay. Then let's go to pathological causes of what? Hyperplasia. So what is the first cause of pathological cause of hyperplasia? What do you think? The first one we can talk about here. It is because of normal production of hormones causing that. Then here there is excessive hormone production. Okay, excessive hormone production. So remember that under pathological, something has to be abnormal. So that's when you can say something is pathological. Here there was normal just production of hormone. That's why there is hyperplasia of female breast. That's a normal response. Here now, if there is excessive hormonal production, like in what condition? Someone who is having like imbalance between progesterone and estrogen can result in what? Endometrial hyperplasia. So that's a pathological what condition. Endometrial hyperplasia is not a normal response of the body. It's basically the abnormal response caused by certain things, pathological causes. Okay, so we are saying good example is what? Endometrial hyperplasia. Endometrial hyperplasia. Good important point here. So if someone is had or having endometrial hyperplasia, they are at increased risk of developing endometrial cancer. Very, very important point. So people who had history of endometrial hyperplasia or having endometrial hyperplasia, they are having an increased risk of what? Developing endometrial carcinoma or cancer. So that's the first cause of what? That's the first pathological cause of hyperplasia. Okay, what's the second point? Okay, the second point is now here we said hormones, and here we said compensatory hyperplasia. Now there is apart from excessive hormonal production, there is also another one which is chronic injury or irritation. So chronic injury or irritation, someone having a chronic injury, or maybe there is inflammation in the body. So inflammation basically can lead to what? To hyperplasia. How? Remember that if you have a damaged epithelial tissue there, if there's damage there, what happens? Then the cell has to what? Cover up the gap by doing what? They need to what? To divide, so that they can cover that injured part, or that injured part can be replaced by normal cells. By doing that, by doing what? By dividing. So basically, chronic injury, it can cause what? Cells to start dividing. So now that injury is the pathological cause. Okay, but basically, where does that happen most of the time? It can happen in the oral mucosa, the epithelial lining of the oral mucosa, and also the epithelial lining of the skin. So that's where that inflammatory response can occur. Okay, so that's under chronic injury. What are we saying? Here we are saying basically we're just talking about irritation of epithelial lining of the skin and oral mucosa. Okay, so those are the important parts that we need to talk about. Now let's go to the second part, which is the mechanism of hyperplasia. Mechanism of hyperplasia. Very, very, very important part. Mechanism of hyperplasia. Remember that the reason why there is hyperplasia is because of what? Increased weight load and increased what? The functional demand. If now mechanism of hyperplasia means that how does it what? Overcome increase in weight load, and how does it overcome increase in functional demand? So we'll look at here how it can result to that. Okay, so what's the first thing? What's the trigger to that? So mechanism of that, what are we saying? Mechanism of that, we are saying here it has to increase what? Number of what? Cells by what? By undergoing mitosis. Okay, or cell division. By undergoing cell division called mitosis. That's how a cell can what? Can become main in number. So it's because it's undergoing mitosis. Now, what can trigger mitosis? Remember that we need, like in other video, we are talking about the stimuli for what? Or things that can stimulate the cell to do something or to activate the signal transduction pathway. So we need to talk about that. What are those? Here we just talk about two. The first one is what? This one. The first one is what? A growth factor. Growth factor. So examples of growth factor, what? Insulin-like growth factor, fibroblast growth factor. They are also like transforming growth factor, beta. So there are a lot of what? Growth factor. Those are the ones that will come and bind to this receptor, which we call growth factor receptor. So this is a growth factor receptor. Growth factor receptor. It will come and bind there. Okay? Then let's go to this one. What about this one? Because if you look at the causes, also there was hormonal causes. So mean that also hormone can come here. Okay? Can come there and bind to the what? Hormonal receptor. So this is what we call hormonal receptor. Okay? Hormonal receptor, where hormone is going to what? To bind from. Where hormone is going to bind from. Remember, what is hormone? By definition, hormone is a substance, is a chemical messenger that is produced by what? Endocrine glands, and stimulate other glands or organs to function. Okay, so this hormone will come and bind here and activate this hormonal receptor. Okay, hormonal receptor. So this is hormonal receptor. Okay. Now, what happens if this growth receptor and the hormonal receptor activated? What do? They do this. They activate the signal transduction pathway. They activate the signal transduction pathway. So there are a lot of signal transduction pathway, but for now, since this is a general pathology, we'll come and talk about it in details in future lessons. Okay, so just know that the growth receptor and the hormone receptor, if they are activated, they are going to activate the signal transduction pathway. That will lead to what? That will lead to activation of what? The transcription factor. So activation of what? Transcription factors. So again, there are a lot of transcription factors. So we'll come and talk about the cell division and talk about the various transcription factors that promote cell division. Since we are talking about hyperplasia, where a cell will divide, so there are some transcription factors which will promote what? Cell division. So here, just know that it will activate transcription factors. So these transcription factors now, what do they do? If now they're activated, they will promote what? They will promote a cell to start what? Dividing. So what am I saying? Now, if they activated, promotes what? A cell to enter a cell cycle. So promote what? Promotes cell division. Okay? If a cell now divides, what's the result? It's going to increase number of what? Cells. If now the cell division, then it will lead to the increase in the number of cells. What happens now if there's increase in the number of cells? What happens now? Now it's going to what? Decrease workload. If there are a lot of cells that are there, I mean that also the amount of work that is given to each cell is going to decrease, because there are a lot of cells that are now overcoming that amount of workload. If they are overcoming that workload, it's going to decrease what? Workload. What else? Also, it's going to decrease what? Functional demand. Remember that functional demand is what? The amount of work or activity that is required by the cell to perform. Okay, so now also the functional demand is going to decrease, meaning that the cell performance is going to increase. Or how much a cell is going to perform is going to increase, because cells are a lot in number. Okay, what else? Now, since we are done with this is now all the mechanism that we need to talk about. Remember that the overview of this mechanism is that the cells, they are going to become main in number because of what? This thing that we talked about. The signal transduction pathway, activation of transcription factors, promoting cell division, and also resulting in the increment or in the number of what? Cells, and because of that, there will be decrease in workload and decrease in functional demand, counteracting this cause, the reason why a cell was undergoing hyperplasia. What can you see from morphology? Okay, morphology means that what you can see using either your naked eyes or microscope. What can you see? So, using your naked eyes, what can you see? Naked eyes basically grows. What can you see? You're going to see the size of an organ increase. Increase in the size of organ that is under growth. Microscopy. What can you see? Now, increase in the number of cells. So under microscope, you can see increase in the number of cells. Okay? So now, for now, we are done with hyperplasia. So the last now part is metaplasia. And make sure that you subscribe so that you can be updated with all upcoming videos.